Hello, I'm Dr. Stefan. I'm a doctor of information technology, and I'll be installing your robotic cranial nerve today. I understand that previously you'd not been informed about the role that the cranial nerve plays, and thus you cooperated with the doctor to remove your cranial nerve, and you've been rescued from the tingle exclusion zone, and we're going to help put you back together again. So, I'll tell you what a cranial nerve does. Essentially, your cranial nerves communicate with your cerebrum, essentially your, sensation area of your brain. They basically help to communicate the things that you sense, largely to do with the head, but, it involves olfactory things, involves, taste, touch, vision, sound. I'm not actually a doctor, I'm a doctor of information technology. That's why I'm suited to install your robotic cranial nerve, but that's very much the extent of my knowledge. So, you signed all of the consent forms and everything like that, so I think we're good to begin. Do I have consent to touch you and perform an invasive elective surgery on your head? Good. Before we begin, of course you'll understand that it is procedure to sanitize the hands. So I'll do that now. This seems to have a lid. Interesting. Okay. Just let me sanitize my hands. The surgery itself is quite simple, and I perform it very frequently. Mostly on robots, some androids. You yourself, you're not an android yet. You'll be a cyborg technically after this. Isn't that exciting? But I have a lot of experience in this area, so there's no need for concern. Your nerves in your cerebrum play a connective role with your nociceptors, and so we won't be using anesthesia for this surgery, as it's not necessarily needed because you can't feel anything. That's, again, you understand that. Very good. Now I'm just going to put on these gloves, as the complications from this surgery can be quite dramatic compared to the surgery itself, of course. An infection in your brain, can be, that's really it. If you get an infection in your brain, you're going to die a lot of the time. If you get something like an inflammation in the brain or encephalitis, something like that. That has never happened to any of my patients, of course, because I take necessary precautions. But we will be cleaning the wound site frequently, every day, essentially, how this procedure is going to work is I'm going to make a small incision. I'm going to reach through into your brain, and I'm just going to put the nerve in where it should go. It's a very safe procedure, and the rest of our time we will be just testing if it actually worked, if you can sense. So we'll be going through all of your different senses and things like that. Now, I do have to say I don't have many medical tools. Really, I operate less on humans, as of course most of the humans are in the tingle zone, as robots cannot experience tingles. Yada yada, you know the rest. I'll have to use what I usually use on my other patients, which is just this X-Acto knife to make the incision. Again, it won't be painful because you're unable to process nociception in your brain. Nociceptors are, of course, the receptors that receive pain signals. Anyway, just let me... It shouldn't hurt, because nothing should hurt for you. There we go, a very simple incision. Now, I do still see the hole that they made in your cranium to pull out your cranial nerve. So I'll be using that to install your new cranial nerve. Just have to apply. Let me just... Okay. It's all going well. No complications. Nothing of the sort. Okay. Here we are. I'm just going to twist the screw a little bit, placed above. Okay. I think that's good. I'll move on to the next stage of this. Just going to sand down this. Just putting over the... It's all good. It's okay. And just going to lock the outside contraption in place. let me just wipe down that area. Okay. Almost done. See, you can't feel anything. Now, there'll be a point when you can feel again. After I flick the switch, it's Bluetooth, so you'll be able to turn it on and off with your phone. Let me just apply a small local dressing. Smooth, no bubbles. This dressing is waterproof, so you can have showers and everything. I think that looks very good. Okay, yeah. Now, I'm just going to change this pair of gloves, and then we'll get into the next, phase. So, how do you feel? Now, actually, this is a good opportunity. Where is it? Oh, okay, I'm just going to turn on your cranial nerve. Okay, so you should slowly start to feel your senses come back. Sorry about the time, but I just need to. Okay, now we've got a variety of different tests that we're going to use just to see where you're at, how effective the surgery has been. Do we need to go in again, move anything around? Should we replace more parts of you with robotic instruments, etc., etc.? Let's see. Okay. Before we start, I'd just like to see your tongue. So if you could just open for me. Say ah. You don't have to say ah, but the point of that is so you can get, yeah, you get what I mean. So let me just. Okay. Okay, well, since I've got this, we should probably start with taste. I'm going to put a drop of sugar solution. This is a sugar solution we use to help people that are about to go into a diabetic coma, if they're in emergency need of some sugar. So this is a very sugar-intensive solution. I've just put a drop on the end of this, and all I need you to do is tell me, do you taste it? Okay? Okay. Open up. Just laying it on your tongue. Yeah, it tastes like sugar. It is sugar. Okay, next up. What do we have next? We've got a very important one. It's the touch perception of the face. So I'm going to be going at different parts of your face, touching it, asking you, do you feel it, do you not feel it? And then I'm going to ask you, how many points do you feel? And this can just help me gain a proper understanding of, your sense perception. So I'm going to start with a brush, because I feel like it's a little bit of a gentle way to start off. Now just sit there. Okay. Do you feel this? Do you feel this? Okay. Do you feel this? Do you feel this? You feel this? Do you feel this? Up and down. Do you feel that? Yeah. How about this? Just across your forehead. Do you feel that? Just gently. Very gently. Okay. What about this? On your nose. Do you feel that on your nose? Yes. Okay. I'm just going to do some dotting motions, okay? And if I make a noise and you don't feel it, please tell me. Okay. Yeah. You felt all of those. Good. Glad to hear that. Okay. Okay, now, in the next section, I just need you to tell me, am I using 2 fingers or 1? Okay. Do you feel 1 point or 2? Okay, so I'll just see you just mouth which one. Go 1 or 2. 1, 2. Okay. One, two. sensors will vary across different points of your body. You're going to be most accurate on your hand, where you feel 2, 2, 2, and then eventually 2 will be close enough, and you'll feel 1 point. Different areas of your body, different levels are normal on your back. You know, you can have a wider area. That's just one of the tests that we do. I've got some spoons here, and I'm going to be testing your hearing, okay? I'm not going to make any loud or abrupt noises. I'm just going to be making different noises for you ear to ear, and I just need you to just respond with a thumbs up, a kind of sign or a thumbs down. And what we're going to be looking for here isn't if you can hear it or not, it'll be, does it sound muffled? Is there any audio glitches? And this won't sound like a traditional hearing thing. This will sound like a robotic issue because the cranial nerve we installed, of course, is robotic. So, tell me if you hear any audio glitches. test your sense of smell. Some people, after having this surgery, become completely anosmic. The majority of people don't. And people that do become anosmic, of course, we can fix that, but that'll be with the installment of a new nose, which is usually something that's a bit more complicated. Probably shouldn't touch my face, but whatever. I haven't touched your dressing, so anyway. I've got a scented candle here, and I just want to see if you can smell it. You don't have to tell me what smell it is, though that might be interesting. I just need you to tell me if you can smell it or not. Okay? Can you smell that? Yeah, it does smell like lollies. Man, I love this one. Watermelon lemonade. It's a good smell. Now, another classic noise making material that we like to use is paper. Paper, I think maybe there's something about the speed of reverberations or all of the different noises that it makes, but something about it will really help us identify if you've got any glitches with your cranial nerve. So, I'm just going to make these noises, and you can just, speak up or raise your hand if you're noticing any glitches, okay? Noticing any audio glitches yet, are you? Okay. Well, we've got one more paper-based noise left. This will test your higher frequency range. said, I've done an heaps before. Patient is extremely aggressive. Okay, well, I'd like to say you've been a great little test subject. I'm glad you can feel and smell and see properly and everything. And I'll be here if you need any other robotic implants of any kind. You know, I never studied this, but you know, ever since the Tingle Zone got enacted and society kind of split, of course there is nowhere to study, so I'm probably the most qualified person you know to do this kind of thing. I'm just going to finish writing down these notes. You can stay there or go or anything. You know, you can just sit there for a few minutes if you want. See if you have any adverse reactions, but I really don't think you will. Okay. I'm just going to finish my notes.